Hi, this is John Barras, cosmetic dentist in Houston, Texas. I recently got an online question from Ryan regarding cosmetic dentistry, smile makeovers. And Ryan was wanting to know how dentists charge or what they charge for cosmetic dentistry. And it's a good question, and it's very commonly asked. So one of the things that you really need to look at is if you just simply go look in the mirror and see if you're wanting a cosmetic makeover, we're usually looking at the teeth that you can visibly see in the mirror. So it's common that a lot of people show 8 to 10 teeth on the top and may not show any teeth on the bottom. And then you've got some people that smile and you can see every tooth that they have. It may be 24 teeth that they were showing. That is a range. So obviously the cost is going to go up for a smile makeover if you show all your teeth in your mouth. So that's one thing to look at. Obviously, if it's a single tooth, like an implant crown or a single veneer that broke, that's a little bit different. But you get the idea that it's based on the number of teeth. There's also another thing that goes into cosmetic dentistry and smile makeovers and cost is the dentist training. How much training do they have? Is that the only thing that they do is cosmetic dentistry and smile makeovers? You might want to ask your dentist how many cases they do. Is that all that they do? Or where did they get their training from? Do they have any training in that? Another factor that's also involved is what laboratory that the dentist uses. You have all ranges of laboratories. You have really cheap and expensive laboratories, and then you've got really high-end laboratories that really kind of specialize in cosmetics and bite and function and things like that. So you could have a brand new startup laboratory that is real cheap, and you could have an experienced laboratory that has master ceramist that's been there for 40 years that does only high-end. So that cost is going to get passed on to the dentist. So the dentist has to obviously charge more if he's going to get charged more for doing the veneers and the lab work. So it's real important that you ask those questions and really look at how you're going to make your choices. So if aesthetics are really a big concern, you might want to spend a little bit more to get exactly what you want. We do see patients that come in quite a bit that may have gotten it done cheaper that end up spending more money long term doing it multiple times. So when you're checking out your cosmetics and things like that, that's really what you need to look at. Ranges for per tooth could be into the upper hundreds. It could be, I've heard $700-800 per tooth, and then it could be up into the 2000s per tooth. So that's a range that's probably pretty common. So sometimes you get what you pay for. So just ask questions to your dentist and ask about their lab when deciding your cosmetics.